Another important category of liquid dosage forms is non-aqueous solutions, where water is not the primary solvent. And then a key example of this type is the fluid extract. Fluid extracts are also called 100% tinctures. They are alcoholic or hydroalcoholic preparations made from vegetable drugs. The defining feature of a fluid extract is its standardized strength. Okay, 1 ml of a fluid extract contains the therapeutic constituents of 1 gram of the plant or drug it represents. This standardization makes fluid extracts very concentrated and potent, so only a small volume is needed for a therapeutic effect. Because of their high alcohol content, fluid extracts are stable and self-preserving. They are commonly used when large amounts of plant material need to be concentrated into a convenient liquid form. So the methods of preparation here, fluid extracts can be prepared using first, the process A, or the menstruum, iyahang menstruum kay alcohol, uses alcohol as the primary solvent to extract the active constituents suitable for substances that are alcohol soluble. And then second, process B, 2 menstruum ang gamit, involves using two different solvents in sequence to ensure maximum extraction of active ingredients, and then often used when one solvent cannot dissolve all constituents effectively. Then third process C, fractional or divided percolation. The plant material is percolated in portions rather than all at once. It ensures efficient extraction and reduces waste of solvent. And then the fourth one, the process D, iyang menstruum kay boiling water. It uses boiling water as the solvent, sometimes combined with alcohol to extract constituents that are water soluble but heat stable. And then the fifth one, the process E. Okay. The fifth method may involve other extraction techniques such as maceration or alcohol water combination, depending on the source. Another example of non-aqueous solutions is oleovitamins. Okay, oleovitamins are solutions of vitamins, usually vitamins A and D, in oily vehicles rather than water. They are typically prepared by first diluting fish liver oils with edible vegetable oils or dissolving vitamin concentrates in fish liver oil. The purpose of using oil as a solvent is twofold. First, stability. Vitamins like A and D are fat soluble and are better preserved in oil than in water. Then second, for administration. The oil form allows for oral administration of fat soluble vitamins in a concentrated and easily measured form. Oleovitamins are widely used in pediatric supplements and nutritional therapy, providing a reliable source of essential fat soluble vitamins. In short, oleovitamins are oil-based solutions or fat-soluble vitamins using fish liver oil or vegetable oils as the vehicle, making them stable, concentrated, and easy to administer. Another type of a non-aqueous preparation is the extract. Extracts are concentrated preparations obtained from vegetable or animal drugs. They are made by first separating the active constituents from the raw material, second removing the solvent, and third adjusting the final product to a desired consistency or concentration. Extracts are highly versatile and are classified based on their physical form and intended use. So types of extracts we have here first, semi-liquid extracts. Okay, these are thick, viscous liquids that can be further processed or used directly in formulations. Second, pilular extracts. Okay, pilular extracts are plastic masses intended for making pills, ointments, or suppositories. And then example, pure glycyrrhiza extract, used in medicinal pastes or lozenges. And then third, powdered extracts. These are dry powders obtained by drying semi-liquid or liquid extracts. They are intended for dry formulations such as tablets, capsules, or powders, like for example, belladonna extract, commonly used in tablet and capsule preparations. In short, extracts are concentrated forms of drugs that can be semi-liquid, plastic, or powdered, depending on their intended use. They allow for accurate dosing, easy formulation, and improved stability compared to raw plant or animal materials. Now that we've discussed the types of extracts, let's look at the methods used to prepare them. The choice of method depends on the nature of the plant or animal material, the active constituents, and whether they are heat sensitive. First method, the maceration. In maceration, the raw material is soaked in a suitable solvent at room temperature. The solvent slowly dissolves the active constituents, which are then separated to form the extract. This method is gentle, making it suitable for heat-sensitive materials. Next, the digestion. Digestion is similar to maceration, but it involves slightly elevated temperatures to speed up extraction. Okay, slightly elevated temperatures. It is used for substances that are stable with mild heat, improving efficiency without degrading the active compounds. Then third, the decoction. Decoction involves boiling the plant material in water to extract water-soluble and heat-stable constituents. It is commonly used for roots, barks, and tough plant materials that require prolonged heating to release active compounds. And then fourth, the infusion. Infusion is the process of soaking plant materials in hot water, similar to making tea. It is typically used for leaves, flowers, and other delicate parts that can release active constituents without boiling. And then fifth, percolation. In percolation, the solvent passes continuously through a bed of powdered material. This method ensures efficient extraction and is commonly used in large-scale production. Okay, in short, the method of preparation of extracts is chosen based on the nature of the raw materials and stability of the active constituents. First, maceration and infusions are gentle for heat-sensitive materials, and then digestion and decoction use heat for tougher or water-soluble constituents. The third, percolation, is sufficient for large-scale extraction. Another type of non-aqueous solution is the liniment, which is used externally on the skin rather than orally. Liniments are alcoholic or oleaginous solutions or emulsions that contain various medicinal substances. They are intended to be rubbed on the skin to provide therapeutic effects such as pain relief, warming, or counter irritation. And then alcoholic liniments. These are formulated with alcohol to provide a penetrating effect, helping the medicinal ingredients reach deeper tissues. And then they are often used as counter-irritants, producing mild irritation on the skin to relieve discomfort in underlying muscles or joints. And then next, the oleaginous liniments. They are used oil-based vehicles which are less irritating to the skin. They are commonly used for massage or gentle application, providing lubrication and soothing effects while delivering the medication. In short, liniments are topical, non-aqueous preparation that deliver medicinal effects through the skin. Alcohol-based liniments are penetrating and stimulating, while oil-based liniments are gentle and soothing, often used in massage therapy. Another interesting type of non-aqueous solution is the collodion, which is widely used in topical applications. Collodion is a clear or slightly opalescent viscous liquid prepared by dissolving pyroxylin in a mixture of ether and alcohol in a 3:1 ratio. Pyroxylin is obtained by treating cotton with nitric acid and sulfuric acid, making it partially nitrated cellulose. Again, pyroxylin is obtained by treating cotton and nitric acid and by treating cotton with nitric acid and sulfuric acid, making it partially nitrated cellulose. Collodion forms a flexible, protective film when applied to the skin as the solvent evaporates, which helps protect wounds or deliver medicinal substances. Again, collodion forms a flexible protective film. And then the types of collodion, we have first the flexible collodion, made by adding 2% camphor and 3% castor oil to the basic collodion. The additives make the film flexible, preventing it from cracking when applied to the skin. And then second, salicylic acid collodion. prepared by incorporating 10% salicylic acid into flexible collodion. It is commonly used to treat hyperkeratotic or scaly skin conditions such as warts or corns because salicylic acid has a keratolytic action. In short, collodions are viscous, non-aqueous solutions that form a protective or medicated film on the skin. Flexible collodion ensures skin comfort, while medicated forms like salicylic acid collodion provide therapeutic effects directly at the site of application. Okay, when we talk about oral dosage forms, one of the important considerations is the usual dose of the medication. For most standard oral liquid preparations, the usual dose is commonly 5 ml, 10 ml, or 15 ml, which makes it easy for patients to measure and administer. Exemptions, however, there are some exemptions. For example, magnesium citrate oral solutions often have different dosing requirements due to their osmotic and cathartic effects. These preparations are not given in the standard 5 to 15 ml range, and their dose depends on therapeutic need and patient age. In short, standard oral solutions 5, 10, or 15 ml per dose lang. And then exceptions, some preparations like magnesium citrate, which have a special dosing instructions. Okay, this highlights the importance of reading the label and prescribing information carefully to ensure safe and effective dosing. Okay, first oral dosage forms, we have oral solution. It is a liquid in which one or more active ingredients are completely dissolved in a suitable base. So for example, the oral rehydration solution. Okay, it is easy to swallow and gives a uniform base. And then second, oral suspension, a liquid in which one or more active ingredients are suspended, okay, not dissolved, in a suitable base. Needs to be shaken before use to ensure proper dosing. And then third, oral emulsion, a liquid containing active ingredients that are unstable in water, stabilized as an oil in water dispersion. Either or both phases may contain dissolved solids used to improve stability and taste of oils or insoluble drugs. And then the fourth one, the oral drops, a liquid prepared to be given in small, precise amounts using a dropper or similar device, allows accurate dosing, often for children or concentrated drugs. Okay, let's now have mixture. Mixture is an oral liquid in which active ingredients are suspended or dispersed in a suitable base. Needs to be shaken again before use to ensure uniform dosing, same as suspension. And then elixir, a clear flavored oral liquid in which active ingredients are dissolved. Contains a high proportion of sugar and may include ethanol or diluted alcohol, sweetened and flavored to mask unpleasant taste. And then third, syrup, a thick viscous oral liquid containing one or more active ingredients in solution. The base usually has large amounts of sugar or sweeteners, and then they may contain ethanol as a solvent or preservative and antimicrobial agents to maintain stability. And then the fourth one, the linctus, a viscous oral liquid with active ingredients dissolved in a high sugar base, often used to coat the throat or suppress cough due to its viscous, soothing nature. Now lastly, let's talk about topical solutions. So first, astringents, solutions applied locally to the skin. Okay, these are solutions applied locally to the skin. They precipitate proteins and constrict pores, helping to dry, tighten, and protect the skin. Commonly used for minor skin irritations, acne, or excessive sweating. And then the second one, local anti-infective solutions. These are solutions applied to the skin or mucous membrane to kill or inhibit bacteria. It must be used in the correct concentration and proper conditions to be effective. Examples include antiseptic washes or mouth rinses. Okay, that's all for the liquid dosage forms. And stay updated kay mag-upload ka gihapon ko for the other topics. Thank you everyone for listening.